Hi, guys. Dr. Hampton here. As you know, a board certified family and obesity medicine doc with additional training in nutrition and functional medicine. Here with another video that's going to help you protect your nest. And, we're talking today about the N and the nest because it's important that we understand our sources of nutrition. But what's even more important is to understand when we make decisions about nutrition, where does that come from? And I would hope that that is based in solid evidence. And what you'll find is that you are getting a lot of different messages from your friends, family, and your clinicians that are really telling you different things. Some are really suggesting a low fat diet, and some are suggesting a low carb diet. So the question is, why is there so much confusion when we should be looking at the same evidence at all times? And the answer is that a lot of those confusions come from the types of studies, the quality of the study. So the evidence is there, but the quality of the study is what's not being factored in. So today's video is to help you understand why that confusion exists and how we can make sure that the quality of the studies is at a level that you can depend on. And that's what we're going to focus on today, guys. So I really hope to be able to share that information with you today because I know it's frustrating. It's frustrating for you when you're trying to make decisions for your family and you just don't know what to believe. So now, how am I going to do that? Well, I'm going to do that by putting some slides in front of you to help you understand the levels of evidence. And we'll start with this first slide, which is from the University of New Hampshire. And this is a nice slide because it shows you that there's levels, right? So you have lower levels of evidence, like in a test tube and animal research. And if you think about it, wouldn't it be better to have research on humans? But sometimes we have to start with animals. So we do that when we have to. And then that level of strength goes up. And then you get into those epidemiological studies where people get surveys and things like that. And we'll tolerate that as long as we don't have the higher levels of evidence, which is like randomized controlled trials. So, and then if you really want to take that to the next level, you'll take the randomized controlled trials, and then you can do reviews where you combine them, and then that'll give you, in some cases, a higher level of evidence. Now, if you take lower level studies like cohort trials on down, those epidemiological studies, then you do a systematic review. It's almost like doing a review on studies of low quality. So you end up with a review of low quality. So I think it's important people understand that as well. So let's go to the next slide. And in this slide, you can see the difference between what we call qualitative versus quantitative. And qualitative is more descriptive, conceptual, and quantitative is more analytical. You need numbers, you need data, you need things you can count. So if you're in a situation where you have a choice, you're going to go with that more experimental model to the right and not the observational model to the left. And so, but all these studies are trying to answer certain questions. Who got the disease? When did they get it? And, where did they get it, et cetera. So we're trying to answer questions. But again, the key to this slide is to say, if you have experimental studies, you always choose that. So let's for example, look at examples of why your clinician or your friends and family may think that certain types of diets are not good. And this is an example of a study that was done in the Lancet. And as you can see, it looked at carbohydrate intake and tried to determine, is carbohydrate intake going to affect your mortality? So if we look at what they stated that, both high and low percentages of carb diets are associated with increased mortality, but the low carb dietary pattern, which is animal based, right? And all the things I love, like lamb, beef, pork, and chicken. If I eat those types of food, this is associated with a higher mortality. Whereas those who eat a plant-based diet that, like vegetables and things like that, this study would suggest that there's, a lower risk if you eat plants. So that's an example of a study. But the key, and if you look at the methods section of this, you'll see that the participants completed a dietary questionnaire. So ultimately, the conclusion that came from that study was based on an approach that used questionnaires, right? So that's observational, that's, just kind of observing what people do. Now let's go to another study, which was published. And by the way, that was in 2018. This study, the new study I have in front of you with the National Library of Medicine, is a low carb diet and looking at cardiovascular risk factors. But again, this is a study that is a randomized controlled trial. So if we look at that conclusion, it says that in this study, it shows that low carb diets not only decrease body weight, but also improve cardiovascular risk factors. So in light of this evidence from randomized controlled trials, dietary guidelines should be revisited, which is basically saying should be changed, advocating a healthy low carb diet as an alternative dietary strategy for preventing obesity and cardiovascular disease. So again, now that we have a randomized controlled trial that looked at, this same question, that should outweigh the studies that actually were of poor quality, like the one I previously showed. Now, you may then ask, well, that's just one study, doc, even though it's a review, that's just one thing. So I have some good news. So if there's any doubt that you should consider safely considering a low carb diet, the Public Health Collaborative have helped us out. So if you look at this slide, you'll see that if you focus on the blue, in terms of significant greater weight loss, when you compare a low carb diet to a low fat diet, it's basically 36-0. In other words, there is no low fat diet that was done as a randomized controlled trial that's better than a low carb diet. And if you're looking at just greater weight loss, you can see from this data that it's 58-7. So this information is available. I'll make sure to have a link in the show notes, but it's really important that we look at this and look at it honestly and say, okay, now that we have this information, is it true that a low fat diet and a low carb diet are better than the standard American diet? 100%. So it's nothing wrong with advocating for a dietary approach that you like. But what's not appropriate is to say that, that this is harmful. A low carb or keto diet is harmful when we have the data, when done properly, that doesn't support that it's harmful. So let's go even further. Another thing that you hear from your doctors, your pharmacists and nutrition professionals, this idea about fat's going to harm us, right? And for years, we're talking about 40, 50 years, we've been saying that we should do low fat because saturated fat is harmful. Well, when they started looking at those studies the same way, when they went from those poorly done studies to randomized controlled trials, guess what they found? They found that the limit of saturated fats is completely unnecessary. And this is from the American College of Cardiology. And the part in dark is really important. That's why there's so much confusion. The recommendation to limit dietary saturated fat, right, has persisted despite mounting evidence to the contrary. And this is new, so maybe the clinicians hadn't had a time to catch up. But as of June 24, 2020, this statement has been made. So we want to go even further, and that's why I really wanted to get this video in front of you. What about the American Diabetes Association? Now we got the American College of Cardiology making some positive statements that fat's okay. But what about the American Diabetes Association and their ability to tell us, which dietary pattern is okay? And so I thought it was really important. If you didn't get the memo, they've already put this out. And I think it was at the end of 2019 that they do recommend these dietary patterns that you see in front of you. Now, they've always said things good about Mediterranean, vegetarian, vegan, low fat, DASH, etc. But now you can start to see this whole low carb methodology kicking in. You got a very low carb diet. You got a low carb diet, and paleo is similar to low carb. So now you have some choices. And so if you're nervous, or if your clinician is nervous about, I don't know if that's safe. Well, the American Diabetes Association has now said that it's safe. And I kind of know why. One of the reasons is because this lady that you see in front of you, Tracy Brown, now she was the president of the ADA for a while. And during her tenure, she was able to share, not necessarily through the organization, but she did appear on the Fasting Lane podcast. And during that interview, she shared that she was able to get off of insulin, and she was able to get off of most of her medicines. At the time of the recording, I think she had gotten down to metformin. So it is really important that people like herself in positions of influence are able to share the message that, you know what, this lifestyle thing really works. Now, she's not really with the ADA anymore as of October 6th of 2021. But when they made the announcement, they talked about her tenure being transformational. I would argue what would be even more transformational is that she'd be willing to speak to this topic publicly and say, "Hey guys, I was able to get off medicine, taking this lifestyle approach, and so can you." So I'm hoping that as she transitions to another organization, Walgreens in this case, that she's able to share that message. So I think it's really important that we walk away from this conversation with a couple of takeaways that I just want to suggest we do. So number one, it's difficult to unlearn, right? So when you learn this information, you can't cover your eyes and say, I didn't hear it. And you can go and check. I'll make sure to have links to the appropriate information so you can look at it yourself. So, but the key is that, let's choose a diet that works for us. So if you decide carb restriction is not for you, that's fine. But if you decide a low fat diet is your thing, vegetarian or vegan, that's totally okay. But what you don't want to do is demonize the people who do it a different way, especially when you have, randomized controlled trials that's saying that meat's not harmful and eating low carb or keto is not harmful. That's the first step. Number two, this knowledge is very limited, right? So we have people in our family, in our community, our coworkers, et cetera. They're getting sick. They're thinking that I'm going to be on medicines for the rest of my life, right? So they don't have to be on medicines for the rest of their life because I take people off of insulin and medicines regularly. I do it with diet, no fancy pills or anything like that. So you need to make sure they have the knowledge of this information. So please share this video with your friends and family so that they will have the knowledge. And number three, when you share it with them, it's going to be a little nerve-wracking for their clinician who is not familiar with this. So you may want to share it with their clinician as well or encourage them to. And then I'll make sure to have a link to the guidelines that I use and many of my colleagues use to restrict carbs in a safe manner. So those dietary guidelines are published on the Low Carb USA site. They're published on Society of Metabolic Health Practitioners site. And I want to make sure that information is available. So if you decide to get off of your medicines and insulin, as an example, you'll know how to do it safely. So that would be really key. And finally, I want to make sure we support organizations like Nutrition Coalition, led by Nina Teicholz, because those organizations are really in the business of making sure dietary guidelines are actually evidence-based. And we have the evidence. We've been doing research on low carb since 2002 at least. I know Dr. Eric Westman at Duke's been doing that for a long time. So we have plenty of studies that support this way of thinking. So I'm really happy that you came to my channel today. And of course, I'm going to ask you to like and subscribe. But I really want to encourage you to keep being a continuous learner, because as we learn, we're going to be able to then make decisions that are better for us. So as I wrap up this video, make sure to be safe, be well, and continue to protect your nest.